Anyone encountering the healthcare system right now knows that it's spread thin and just barely staving off crisis. A new report from the Institute of Health Policy, Management and Evaluation at the University of Toronto adds to that picture, saying we need a major overhaul of Canada's primary care system. Sarah Allen is the lead researcher on the report and an associate professor at the U of T, and she joins us now in studio. And it's a delight to welcome you to our studio.
Thank you so much.
Because you've been on this program before, but always online.
Yeah, it's a pleasure to be here.
Great to see you in person. Okay, let's do this. Oh, first of all, in the interest of full disclosure, my wife is a health policy consultant. She's never done work with your institute before. You don't know her, but some of the issues we're talking about here today, she is, I gather, peripherally involved in, and so we put that out there in the interest of full disclosure. Let me list a few of the key findings that are in your report, and then we're going to go do a deeper dive on each of them. For example, you want primary care in this province overhauled. You want multidisciplinary, team-based approaches to how we do healthcare, and you want a pan-Canadian health data strategy. Am I on the right track so far?
Yes.
Okay, let's dive into each one. Primary care reform. What do we need to do about that?
Well, this report looked at the whole health system, and we looked at it from the lens of both sustainability, so how can we ensure that it continues to provide good quality care to improve our population's health in the long run, but also resilience. So how able are we to withstand shocks, to recover from them, to adapt and learn? And at the core of both of those things is a strong primary care system that can help to sort of achieve both sustainability and resilience. And it's an area where Canada falls short. So there's been a lot of attention in the past few years as we've gone through the pandemic on lots of failings in the system. And one of the ways that we can address many, but not everything, but it's really at the core, is strengthening primary care, ensuring that people have access to that first point of contact when they need it. And
that basically means everybody getting to see a family doc.
Everyone should be able to see a primary care provider. Yeah. And whether that's a family doc or a nurse practitioner or someone else on the team. So you feel like your needs are met, you're supported, whether it's daytime or night. You don't need to go to the ER. And then you're followed through the system as you age, as you encounter urgent and complex conditions, and your family as well can be cared for. So there's a fundamental sort of restructuring of our system that is needed to just allow for that sort of basic piece of the health system.
I have to tell you, I've heard, and your report will be one of many that has made this point over the last many decades. Why do we still seem to be so far away from the promised land on this?
Yes, it's a great question, and much of the report that we've produced it's not going to be new or shocking or surprising to anyone, but it's important to look at it now as we're recovering from a pandemic and to keep trying to push towards change. And as you say, it's very difficult. So we know that there's been a lot of investment in the early 2000s in primary care. So all the governments in Canada agreed that we're going to invest more. And we did. We spent more on primary care providers. We've increased the number of nurses and doctors. However, we haven't really changed the way they're working. And there's some models out there. In Ontario, we have some innovative team-based care models, and elsewhere in Canada as well. And so there are some pockets where we see this change happening, but what we need to do is try and build on those, to scale them, to support them, and to allow all providers who are working in primary care to be linked up with a team.
So this is not necessarily a question of our not having enough doctors or nurse practitioners in our system. It's a question of how we employ them?
I think it's a bit of both.
It's a bit of both.
Yeah,
okay.
I think it's a bit of both, because when we look at comparative data across other high-income countries, we do see that there are fewer doctors per capita, so adjusted for population size in Canada than many other countries, and it's below the average for OECD, so the group of high-income countries. And so we know that we're a little bit below the average, which means we might need more people. We also know that there's a distribution problem. So we have a concentration of providers in urban centers, not as many outside. But we also are experiencing higher rates of retirement, high vacancy rates. Obviously, burnout is a major issue. So it's both. We need more, but we also need to support the change in the way we practice and the way we sort of structure the system. And so that involves linking up providers in a team and ensuring that they're connected with other parts of the system.
Tell me if this is an issue, because I have heard this anecdotally, but you've done an official study, so you'll know, whereas my stuff's just stories. I have heard that unlike doctors of, say, 50 years ago, who were married to the job and were content to work 80 and 90-hour weeks and never see their families and have very unbalanced lives, that doctors coming out of medical school today don't want that. They want more balanced lives. And what it means is it's harder for their patients to get in to see them because they're simply not keeping as many office hours as doctors of a generation or two ago. True or false?
Well, there's not a lot of evidence to back that anecdotal sort of experience up. However, there are changes in the way people are practicing that we need to consider. So, for example, the types of small businesses that perhaps physicians in the previous generations were used to having to set up, that might not be desirable anymore. For example, we might not want to have to worry about being a small business owner, whereas if you join a team that's already established, you have the supports, the admin staff, you don't need to worry about hiring and the stress of sort of being a small business owner. Those might, there might be a sort of shift away from that. And so given that there's a desire to both have work-life balance, but also be supported in your work environment and not be alone, responsible for a team, then you could be linked up with a broader team. So we know that there is some supports that come with team-based care, for example, that allow people to sort of move into their practice with supports, with allied professions that they can refer their patients to, for example, pharmacists, social workers, dietitians, to meet the needs of their patients without having to do it all themselves.
Gotcha. I want to put something to you that Sylvia Jones, the health minister, sort of famously said not too long ago. She said, after decades of inaction, we can no longer stand by and support a status quo that cannot respond to the current challenges the sector is facing. What did you take that to mean?
I think it's really important to think about the challenge with bringing about change. So yes, we have been in a fairly static mode for many decades. So the Canadian health system looks really similar to how it was originally constructed in the 1960s, when we sort of started to pay for things collectively in a universal way. So universal health coverage was established. This is a great achievement in Canada. And we've improved quality, we have a robust workforce that's really well trained, but we haven't really changed the dynamic of how care is delivered, recognizing that we're older, that we have complex health and social needs. And so I agree that we need to change things. And so
the question is how?
The question is how. Mm-hmm. And I think, we have examples of how change can happen, and providers and health organizations and the health workforce are highly skilled, and they need to be supported to be able to do their work. So supported with, funds and staff and teammates, but also with data and information systems. And those are the sort of things that governments can do to help them to do their best.
Can I make one recommendation?
Yes.
That I don't know if this is in your report. Sometimes I'm told doctors still use fax machines to send information to pharmacies about getting their patients prescription medicine, or fax machines to diagnostic clinics in order to get the requests in for their patients to get MRI or an X-ray or whatever. How in 2022 are we still using fax machines to communicate within our healthcare system?
It's true.
I'm not wrong about this.
It's a sad fact. It is true, and we see it more and more infrequently, but it is one of the few, I think it's probably the only industry that still uses the fax machine. But data and our lack of data, both for people as patients and to be able to access that, but also for providers to be able to share the information that they're getting, lab tests and referrals and prescriptions. This is not integrated. It's not following the patient. This is an area where Canada really is lagging compared to other countries. And so one of the recommendations in the report is really to advance this. So we need to both improve the the interoperability, so data can speak to each other across hospitals, primary care, labs, et cetera, but also that we need to ensure that the data are being provided back to health organizations, providers, in a way that's comparable so they can see where they're doing well, where they're needing to improve. And how can we track that at a Canadian level? Because people move across the country. You know, we're residents of Canada, and it would be really nice if that, you know, data systems could actually speak to each other across provinces as well.
In our last minute here, I want to ask you about I think what one of the main problems is in healthcare today, and that's access. People can't get access to doctors or tests in a timely fashion. They got to go to the ER too often for stuff that's not emergent, of an urgent nature, rather. What do you want to do to improve access to healthcare in this province and in this country?
We need more people. We need to support them better. And so we need to pay them, you know, enough to keep them in their jobs. We need to leverage all of the different workers that we have, both in Canada and those newly coming to the country, and ensure that they're able to work, even if they've been trained elsewhere. So building up and supporting the workforce is essential. And then I think primary care reform in terms of allowing doctors and nurses and other providers to work in a team to provide that wraparound care during the day and at night, and linking with the other parts of the system. These are some of the areas that I think will make a dent in improving access. There's 29 or so recommendations in the report, and if we follow all of them, then I know that we would be able to address wait times and access problems in Canada.
What's the price tag on those 29 recommendations?
It's not possible to put a number, but I think we do need to spend more. I mean, we spent more in the pandemic. We saw that we could, you know, shore up some additional funds, and the federal government stepped in. I think they will again, and I think we'll get out of this crisis with investment, but also with reform.
Problem is, people want a Cadillac, but they only want to pay for a Chevy. That's the problem. Anyways, I'm pontificating too much. Sarah Allen from the Institute of Health Policy Management and Evaluation at the U of T. Really good of you to come in tonight and help us out with this. Thank you.
Thank you.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.